Bad cholesterol is one of the most important notifiable risk factors for heart attack. And in the United States, someone has a heart attack every 40 seconds. A new nationwide campaign has been launched. It's called Cholesterol 911. And here to tell us more about its lipidologist.
Clinical lipidologist.
Yeah, clinical lipidologist. Okay, 3, 2, 1. Bad cholesterol is one of the most important notifiable risk factors for heart attack. In the United States, someone has a heart attack every 40 seconds. A new nationwide campaign has been launched. It's called Cholesterol 911. And here to tell us more about it is clinical lipidologist Dr. James Underberg. Thank you so much for joining us. Now, what is the link between high bad cholesterol and heart attack or stroke?
Well, as you appropriately mentioned in the beginning, a high LDL cholesterol is a key risk factor for having a heart attack or stroke, especially in people who have already had an initial heart attack or stroke. And in fact, 1 out of 3 people will have a second event, cardiovascular event, who've already had that first one, which is why what we're talking about is such an urgent issue. And even more importantly, if they're going to have an event, the majority of those patients are going to do it within the first year. This is why we really want to create an urgency around knowing what's your LDL cholesterol, because if it's too high, it needs to be lowered, and lowering it makes a difference.
Right. So what are some warning signs or some symptoms of having that high cholesterol that people can look out for?
Well, that's the issue, is that many times you don't know unless you have it checked. And so the reason that we're focusing on this Cholesterol 911 campaign is to promote awareness around the importance of knowing what your LDL cholesterol level is and should it be lowered. And so that's really the key first step, is identifying whether or not there's an issue and starting a conversation with your provider. And that's why Amgen has started this Cholesterol 911 campaign to help patients start the conversation with their providers. 7 out of 10 people who have cardiovascular disease don't have LDL cholesterol levels where they should be. And in fact, in Florida, 810,000 people have cardiovascular disease, and over 75% of them have high LDL cholesterol. This needs to be addressed.
Wow. So through this campaign, who exactly are you trying to reach? Is there an age bracket or anything like that?
Well, you can have heart disease at any age. And if you've had a stroke or a heart attack, this applies to you. So we're trying to reach patients. We're also trying to reach friends and family members. Anyone can go to cholesterol911.com, find out information that can help those who have risk for having that heart attack or stroke start the conversation. There's tools that people can download to have a conversation, to ask other questions, how to get to someone who can actually then measure their LDL cholesterol and tell them whether or not they need to have a greater or more aggressive intervention.
Okay, so everyone should check out cholesterol911.com. Thank you so much for joining us this morning. You guys can head over to our website, firstcoastliving.net, to watch